Hi, I'm Ron Zimmett. I'm a trial lawyer in Florida, and I've been the General Counsel of the Mental Health Risk Retention Group for many years. I've also acted as risk management consultant for Negley Associates, and this is the ongoing series of risk management tips sponsored by Negley Associates. Last month, we talked about one of the major problems for mental health care providers, that is sexual misconduct, and 3 issues we talked about to resolve that problem. One is comprehensive training, then opportunities for staff members and supervisors to keep talking about the issue, and the last is adequate insurance. This time we'll talk about all 3. First, supervisor training. There should be a separate training for supervisors. The supervisor training could include discussion of how, when, and how often to review patient charts and what to look for as indications of a possible problem. Examples include failure to chart a known appointment, inappropriately long appointments, and gaps in documentation. Supervisors should also be aware of the warning signs that indicate an employee is more vulnerable to the temptations of sexual misconduct and what to do when there's a sign. Warning signs include personal problems such as divorce, death of a spouse or other close family member, alcohol or drug problems, financial problems, inappropriate disclosure of financial information to patients. Other warning signs include extended hugging of patients, outbursts of anger, defensiveness during supervision, reluctance to discuss a particular patient, contact between a patient and employee outside the physical location appropriate to the service intended by the center, and inappropriate clothing. Supervisors could refer employees to an EAP program or other appropriate mental health care resource and discuss with the employee their increased vulnerability to boundary violations and what to do about it. Supervisors could also document this type of discussion in the employee's file. Of course, it's prudent for supervisors to follow up with employees to make sure they followed any directives. And what about performance evaluations? An annual performance evaluation is an opportunity for supervisors and staff members to discuss boundary violation issues and questions unique to that particular employee. This discussion could be a required part of every employee evaluation, and the specifics of the discussion and any supervisor directives or advice could be documented in the evaluation. All right, so now what about insurance? Because sexual misconduct has been the #1 mental health care provider claim for decades, it's critical to have professional liability insurance that provides actual and adequate coverage. Don't assume that one insurance policy is the same as another, and that all policies provide the same coverage. In fact, the contrary is almost always true. For example, some policies don't provide coverage for mental distress that arises from instances of sexual misconduct unless the distress also arises from a physical touching. Sexual activity, of course, is not limited to physical touching. Some policies exclude coverage altogether. It's prudent to get advice from a competent insurance professional who has experience in comparing one policy with another, and also that you understand the details of your coverage. The last time you want to learn that you're not covered is when you're served with a lawsuit. Well, that's it for today. On behalf of Negley Associates, I'm Ron Zimmett. Thanks for listening.